Hello, my name is Karen. I work for Dermapure and we're the proud distributors of Dermaquest in the UK. Today I'm going to talk to you about peels and resurfacers. So firstly, what is the difference between a chemical peel and a chemical resurfacer? The chemical peels are used by aestheticians and medical practitioners to penetrate into the deep dermal layers of the skin, stimulating the skin to cause a controlled wound response. When we do this, we tell the skin that an injury has been made, but in a safe environment. The skin then interacts and repairs itself. By doing this, we will get a little bit of shedding of the skin cells on the surface because this underlying tissue is pushing up the new cells where the new skin underneath is being remodelled and reformulated. The benefits of this double peel is that you can really see a change in the surface of the skin. So we can treat things like acne scarring, anti-aging, sun damage, pigmentation and hormonal pigmentation with these treatments that some of the laser treatments can't do because there's a risk of causing additional trauma to the skin. A resurfacer, on the other hand, is a much more superficial treatment. We can sometimes use these as prep to lead the skin onto a safe journey into a skin peel, or we can do these as standalone treatments. When we use resurfacers, we are really looking at remodelling the top layer of the skin only, so giving a brighter, fresher complexion with little to no downtime. The downtime after skin peels and resurfacer can vary on the skin health, the hydration, what we're treating and what type of skin concerns we have. Our main function and purpose when we do these treatments is to get the best outcome with the least downtime and with the most positive response to the skin possible. Therefore, the health of the skin is absolutely vital. When you talk to your practitioner about whether a resurfacer or peel is appropriate for you, they'll look at your skin and advise you from there. You may need to use some home care products in order to safely take your skin through this journey. The home care products we look at, firstly, would be to have some sort of active agent in the skin from a cleansing point of view. So a glycolic acid or a salicylic acid to really start to break down the skin cells on the surface and introduce the skin into a slightly more active product. From there, hydration is key. At Dermaquest, we have one of the best hydrations on the market, the Essential B5 Serum. This contains 3 different levels of hyaluronic acid, which is going to really hydrate your skin. It's a bit like trying to run a marathon without a drink. You might be able to do it, but your body will not thank you the next day. With the skin's point of view, if we're causing minor trauma to the skin, we want the skin to be able to recover quickly, effectively, with little to no downtime. Therefore, hydration for everybody is key, even the acne oily clients. The danger there is we assume that there's a lot of water in the skin, whereas in actual fact there's a lot of oil in the skin, and we still need the water hydration to be present. So a hyaluronic acid would be perfect preparation for anybody having these treatments. The other thing that we need to really look at is pigmentation, particularly for darker Fitzpatricks 4, 5 and 6, where we have a higher level of melanin in the skin anyway. Again, we want to cause trauma to the skin and we want the skin to function safely, but we don't want to stimulate the pigment cells into producing additional pigment and making the situation worse. Therefore, for those skincare people, we really need to look at a pigment suppressor, which is going to enhance their results, give a brighter complexion and really help to aid the healing process of the skin. The benefit to that as well is that they will just look glowing and radiant every day. Pigment suppressors do need to be used on a daily basis because we need to continually tell that melanin cell what to do and not allow it to go off on its own little journey and produce additional pigment. How frequently can you have resurfacers and peels? Again, it would depend on your skin, but for Dermaquest, we recommend a course of 6 resurfacers every 2 weeks, or a course of 3 peels to be performed once a month for 3 months, and then have a 3-month break. Because the peels are more penetrating, we want to cause that stimulation, but we also want to allow the skin time to recover and really see the benefits of the treatment that we've done. Home care is important, and your therapist will advise you what the right products for your skin is. I've already mentioned the Hydrating B5, and that would be an essential home care product for afterwards, but probably the most essential of all of them would be our sun cream, Sheer Zinc. This contains 18.6% zinc oxide, which is an amazing healer for the skin. It's going to reflect the UV, not allow any heat penetration. It also has a blue light and infrared filtering, which for this day and age, as you're watching me on the screen now, is really important because those rays will cause more damage or as much damage as UVA. So home care is really important, sun cream being one of the most. I would finish by saying that at Dermaquest, we make sure that every therapist we work with has full training with us, and it is a CPD accredited session. So they will be able to give you a full rounded consultation. They'll be able to advise you on your skincare needs and give you the right treatment plan to address what you want in the safest way possible for the best health of your skin. Thank you for taking the time to watch this video. We hope you enjoy your products and treatments with us and look forward to seeing you in a clinic near you soon.